Hello, friends. Welcome again to my COVID-19 series. We are today covering the COVID-19 in context of what has happened so far and what's going to happen in the future. So I will be doing this particular lecture in two languages. I will start with an English lecture, and then I will do the same lecture in Urdu language so that the audience in Pakistan they can also understand in detail what I'm trying to convey. So we'll start with the current global situation as of today, and you can see that as of today, that is the 5th of June, 2020, we have a total of 6.6 million cases, confirmed cases of COVID-19 all over the world, and the number of deaths are around 390,000. So on average, the mortality rate is coming around 5.3 to 5.5%, which is what the epidemiologists were projecting in the beginning of the epidemic, that it would be anywhere between 3 to 6%. And obviously, because this is a global average, there are certain countries where the mortality rate is high, like in Italy, in the United Kingdom, in Belgium. And then there are many countries where the mortality rate is quite low, like many of the African and some of the Southeast Asian countries. So as of today, as I said, 6.6 million cases with 390,000 deaths. And at the moment, USA is leading the world in number of cases as well as mortalities. Then it's followed by Brazil. Russia is on number 3, and the United Kingdom is on number 4. So this is the situation as of today. Moving on to see how Pakistan is faring as with respect to the other countries. And if I move on to the next slide, you can see that this is a graph showing the number of cases on a logarithmic scale. So the logarithm is increasing by a factor of 10 for every step. And this is the data for the last 90 days. And it shows the data for Pakistan, and it is comparing it with the United States, Brazil, and United Kingdom. And we know the United States, Brazil, and United Kingdom have got very high number of cases as well as mortality. So you can see that Pakistan is faring better in terms of number of cases, because Pakistan has got a very high population. It's got a population of 220 million people. And you can see that the number is closing to 100,000. As of today, 89 or 90,000 people have been confirmed COVID-19 in Pakistan, with around 1,800, something like that. That's happened so far. So the figures for Pakistan, if we take it as a ratio of total population, then it's not that bad as compared to United States, Brazil, or Kingdom, which have got much higher rates. But the case of Pakistan is peculiar, because in Pakistan, we can see that there is no concrete strategy to deal with COVID-19 pandemic. The government actually started with a lockdown, which was a semi-lockdown. In fact, practically that was never practiced, because it's very difficult to police each and every region of Pakistan, and probably people were not that much paying heed to what the health system experts were saying. Anyhow, after the Eid season, we have seen a steady rise in the number of cases in Pakistan. And as a function of the cases, the mortality has also increased. And as I was telling you earlier, that as of today, around 90,000 people have been confirmed with COVID-19 in Pakistan, with around 1,800 deaths. Now, we assume that the actual number of cases would be far, far higher as compared to the officially reported statistics, because there's a problem with testing in Pakistan, because COVID-19 testing, as far as the capacity of the system is concerned, and comparing the number of people that we have in population. So it's very difficult to test each and every individual who is showing some sign and symptom which might be suggestive of COVID-19. And then there is a private sector where the cost is around 5,000 to 8,000 rupees per test. Not everybody can afford the testing. So we think that there is a chunk of population which are actually COVID positive, but they are not on the radar screen at the moment, because they cannot afford tests, or they have not been tested. So I think the number of cases, the actual cases, will be 3 times the number of cases that we are actually having officially. So let's say if the cases are close to 100,000, probably 300,000 people are actually having COVID-19 in the population. Moving on to the next slide, we can see this is the details of Pakistan. So as of today morning, the confirmed cases were 89,249, which were officially reported by the Ministry of Health Government of Pakistan, in which 56,213 were actually active cases, and that shows an increase of 3,758 cases over the last 24 hours. The official number of deaths so far has been 1,838, which is showing a rise of 2.1% of the last statistics, and over the last 24 hours, 68 people have sadly died because of COVID-19. And officially 31,198 people have recovered, which constitute around 35% of the cases. And then in the bottom you can see the breakdown of the cases and the deaths according to the provinces or the states. And you can see that the number of deaths have been high in Punjab and Sindh, but obviously these are very large provinces. The peculiar cases of KP hasn't got that much big population as compared to Punjab and Sindh, but the number of mortalities have been high in KP. And again, KP is a poor province. Majority of the population is illiterate. Many of the people are working in Middle Eastern countries as labor, and most of them, they have returned. So there was an earlier speculation that most of these people who returned from the Middle East probably brought the virus back and introduced it to the community and then widespread. But now recently, the data is showing that it's more than 90 to 95% local transmission is going on. And one of the reasons that it's spreading particularly in KP, is that people are not paying heed to the advice, number one. And number two is that the reporting system in KPK is relatively better as compared to the rest of the provinces. So the deaths are being accounted for. So higher the number of deaths have been accounted for, probably apparently it seems like KP is doing a bit bad in terms of mortality, but it may be the number of the reporting. Probably the other provinces are not or not that much accurately reporting on the fatalities. Having said that, moving on, if you look at the comparison of the deaths around those countries which had a very high mortality rate, Belgium was one of the worst hit countries in the world, and their case fatality rate as of a ratio of population was 81.53 deaths per 100,000 population. And then Spain was the second one with 57.43, and United Kingdom 55.64. Again, if you take this ratio and you simplify it further, you would see that in all these cases, and I had a discussion with some of the big guns in epidemiology. I had a chat with Professor Michael Levitt, who is a professor of structural biology at Stanford University School of Medicine, and is considered to be an international authority on epidemiology. And he has been very vocal in expressing his opinions regarding the COVID-19. And he was of the view that somehow there is a natural tendency for all the pandemics. There's something in that nature which puts the brakes on. So obviously, when there's a new pandemic or epidemic in the population, it grows. Why? Obviously, because it's a new infection. People haven't got any immunity. That's so in the first phase, it increases. But then it reaches a plateau. And after that, even if the number of susceptible people is still high, somehow the nature applies brake. And advanced modeling of the data so far has shown that somehow, even if you compare it with the previous pandemics, like the Spanish flu of 1818 and 1819 and the Hong Kong flu of 1957, the death rate as a ratio of population somehow plateaus at 1 death per 1,000 population. So the death rate can increase. But even if the number of susceptible people is high and not doing anything, it would plateau at around 1 death per 1,000 population. And if you look at Belgium, Belgium has got 81.53 per 100,000 population. So if you do the simple maths and take the ratio per 1,000 population, it would come out to be 0.8. So again, it's less than 1. So there is still a capacity of further deaths, to happen in this particular scenario and can go up to 100. But again, because of the robust health systems and because of increased testing, increased public health measures, things have been brought under control in most of the countries, especially the European countries, and we are seeing a plateau and a steady decline in the number of cases. So again, the bottom line is that nature itself applies brake, and at worst, the death rate as a ratio of population never exceeds 1 per 1,000 population. And at the worst that we have seen is the case of Belgium, which has got a mortality of 0.8 per deaths per 1,000 population. Now, some of the burning questions that have been repeatedly asked are what's going to happen in case of Pakistan? Because recently we are seeing an increase in Pakistan. People are very much worried what's going to happen. So what's going to happen in the next few months? If the same thing, if the same trends goes on. Then another question is like, the global strategy of mitigation, where there have been lockdowns of most of the countries around the world, whether that mitigation strategy has worked, whether it's working, what would be the future outcomes for those things. And what would be the overall scenario in future? Are we going to get second waves? Is it going to be eradicated? Is it going to stay for a while? So these are some of the burning questions. And in the next 15 to 20 minutes, we will try to answer these questions. We'll start with what would be the situation in Pakistan, then we'll look at the global strategy, and then we will try to answer some scenarios for the future. So starting with what's going to happen in Pakistan. Now, apparently seems like Pakistan has got no strategy at the moment to deal with COVID-19. Pakistan started with a sort of a semi-lockdown, but that lockdown was never practiced in reality. People were still mingling with one another, and it was a very half-hearted approach. It didn't work in reality. So then the government had no other option. They just lifted the lockdowns. And that was coupled with the Eid festive season, in which the people, they came across one another. There were more chances of people, hugging each other, sitting down with one another, becoming very close to one another. So that also led to an increase in the cases. Now, it seems like apparently that the Ministry of Health is following this notion that the responsibility of health lies on the shoulders of the individuals themselves. So they have to behave maturely, and they have to practice social distancing, but they are not enforcing it on them. So there is not an official policy for strict lockdowns. They are putting it down to the shoulders of the individuals themselves to practice it and behave like responsible citizens. Again, the other thing is that strict lockdowns has never been an option because of the rampant poverty in Pakistan and even in other countries like Pakistan, because the 33% of the public is living below the poverty line. So it's strict lockdown options where the government hasn't got an sort of an exit strategy, or the government cannot compensate for the closure of the businesses and economic assistance to the people. So that there was always a worry that strict lockdowns, if enforced in Pakistan, would further push a significant chunk of the population below the poverty line. And people, if they are not dying of COVID-19, they would certainly die because of poverty. So strict lockdown has not been an option, and that's why probably the government didn't practice that. So apparently seems like the Pakistani authorities are adopting the herd immunity model. So I think they are letting the infection spread in the society and let the population get immune to it. So it would come at a cost, but then hopefully it would lead to long-lasting effects of being immune to coming waves of COVID-19 in case if they come. So in my last lecture, I explained with the help of some models using complex curves that at the moment, the cases which are around close to 90,000, they are expected to rise to up to 1.2 million. So if we take the median values, they are going to rise up to 1.2 million. But the officially reported cases would be less than this, because I told you earlier that Pakistan has got very limited testing capacity, whether it is in the government sector or whether it's in the private sector. So the actual number would be around 1.2 million, but obviously because of the limited testing capacity, the officially reported cases would be far less than this figure. The other factor is, like, in comparison to the European countries, Pakistan hasn't got an aging population. Uh, Here in UK, in United States, in France, in Belgium, other European countries, there's a big chunk of population that is age 65 plus. Around 20 to 25% of population is above this age group. So definitely, and the data is showing that the mortality is highest in this particular group, and that's why we have seen high mortality ratios in UK, in Belgium, in Italy, in the United States, because there's a big segment of the population which is living above this age. And again, it's mostly the nursing home and the care homes. And most of those 80 plus, the mortality has been very high, around 90%. Now, because Pakistan has got an average life expectancy of 65 years at birth. So there is a very little segment of the population which is living above 65 years of age. So even in the worst case scenario, the mortality in case of Pakistan, even if the morbidity is high, the mortality won't exceed 16,000 by all measures of all the modeling that we have done. Seen that the maximum number of deaths in the next 2 to 3 months will not exceed 16,000. And the sort of estimate is that the death rate would stabilize at around 4.3 to 5.3 per 100,000. Or if we do the simple maths, it would convert to 0.04 per 1,000 population, which is far less than what we saw in Belgium, in UK, United States, or Italy. And again, the reason for that is that countries like Pakistan, they don't have an aging population. So obviously, when you don't have an aging population, you don't have that high mortality, which is actually a hallmark of this age group. And obviously because of comorbidities in this age group as well. Moving on to answering this question, is the global strategy working? Now, most of the global strategy has been based on Professor Neil Ferguson model. Neil Ferguson has been a professor of Imperial College London, and he published his landmark paper back in March 2020, in which he had predicted a high number of deaths if there weren't strict lockdowns, school closures, so closure of the businesses, closure of the travel industry, the tourism industry. And that was adopted by UK, that was adopted by certain states in USA, and many other countries in Europe as well. And on the basis of that, we saw strict lockdowns and enforced closures of the businesses. So if we look at overall, there have been 3 models that have been adopted worldwide. Number one have been the model of strictest lockdowns and curfews, and we saw that in Wuhan, in China. We have seen that in certain Middle Eastern kingdoms like Saudi Arabia, United Arab Emirates, there have been strict curfews, and the police and military have been asked to patrol the cities and not let anybody out unless there is a clear-cut reason. Then most of the Europe has seen strict lockdowns and enforced social distancing. So there haven't been curfews, but there have been laws in favor of lockdowns, and people also complied with that. So we have been seeing strict closure of the non-essential businesses, complete stoppage of travel, and enforced social distancing. And there has been a third model which has been adopted in certain Far Eastern countries and many of the low-income countries as well. That was semi-lockdowns, voluntary lockdowns, or no lockdowns at all, as like recently what we are seeing in case of Pakistan. And if we take the data of morbidity and mortality, all these groups of countries which either went for curfews, which either went for strict lockdowns, or which went for no lockdowns, we see that except where they practice good hygiene, where there was sensible social distancing, nothing else has worked because the figures have been more or less the same. And we are seeing that the disease is taking its natural course. So strict lockdowns or no lockdowns, the disease is taking its natural course. In case of any pandemic, if you compare it with the Hong Kong flu of 1957, you compare it with the Spanish flu, so it's following the same trajectory. The only thing is that we have got more scientific knowledge, body of knowledge at the moment on our side. But still, with all these things, we are seeing that the data is hasn't differed much in case of all these groups of countries. and we are seeing an increased morbidity as well as mortality. So, in a nutshell, the morbidity and mortality is following the natural selection method. And again, the natural selection, if you have read the Darwin's theory of natural selection, so nature itself actually selects those species which have got the ability to survive the changing environments. And obviously, as environments are changing, those species which have got less adaptation. And again, if we apply that to the human species, we see that the old aging group, like above those people who are above 70 or 80 or 90, who've got comorbidities, who've got very weak immune system. So obviously they cannot face the wrath of the nature. And we have seen that the highest mortality has been in this group. So morbidity and mortality is following what we call as natural selection. Moving on to the question, so what will be the scenario in future? And we are talking about the short-term future. So, all these modeling methodologies and different experiments and simulations which have been taking place in different countries using state-of-the-art statistical methods and softwares, they are telling us that this disease would take probably another somewhere between 12 and 18 months to go down to either endemic or sporadic levels. So what it means is that it's going to stay for a while. It would steadily decrease, but it would reach a level where the disease would still be there. So you will be having some cases here and there in the population, but it would not reach the epidemic proportion, but it's going to stay. We would be seeing small secondary peaks. These would be isolated peaks, and that can happen here and there. And especially we might see them in vulnerable age group, especially when the environment is in the favor of the virus. So we might see a few small peaks in autumns and winters, like for example in nursing homes, in care homes, and in specialized settings. On top of it, global economic recession will continue. This would result in inflation. This would result in more people being pushed under the poverty line, and this would mean more trouble for some of the economies which are actually struggling at the moment. So we might see more national debts. In case of Pakistan, that simply means that Pakistan will have an increase in its national debt. It would mean more inflation. It would mean more loss in GDP. And this might continue for another two years. This is one of the conservative predictions for the future. So having said that, in a nutshell, this disease is going to stay for a while. The number of cases in Pakistan would steadily rise. It might reach a total of 1.2 million cases, but the total number of deaths would not exceed 16,000. Again, there is a reason for that. In case of Pakistan, there is not much aging population which can get the hit. So people would be getting infected, but at the same time, they would be getting recovered. That would lead to herd immunity. So over the next couple of months, we would see a steady state, and people would get infected, they would recover. And probably over the next 1 year, majority of the Pakistani population would be immune to this thing. So there's a good news that after some short-term, hard times, there's a good time coming, and hopefully this thing will be in control. So thank you very much for listening to this lecture. Again, if there are any questions, you please feel free to ask me. Stay safe, stay healthy. Thank you very much. Bye-bye.